Hi, I'm Dr. Kate McLean. I'm an OBGYN with board certification, and I'm the Chief Medical Officer here at Evvy. We get asked a lot of times, well, what patients should get Evvy testing? So let's walk through that now. First, Evvy is excellent at figuring out the root cause of vaginitis or vaginal symptoms. So, any of your patients who have symptoms of vaginitis, have had recurrent vaginitis, Evvy is fantastic for. So, in other videos, we've talked a little bit about how Evvy testing is different than other testing. And I'll just summarize a little bit of that again now. And Evvy, because we do next generation metagenomic sequencing, we're identifying all of the bacteria and fungi that are living in the vagina, as relative abundances of those bacteria, so you can tell how much of what is present. And that really helps you to discern, does this patient have BV versus, some kind of other infection? Do they have a yeast infection? If so, what kind of candida is causing that yeast infection? And really gives you specific insights. And then we on the platform help your patient and you to come up with the best, most comprehensive treatment plan for whatever those results show. And we've also discussed this piece in separate videos, but we know, especially when it comes to BV, that our treatment programs work extremely well, that our recurrence rate for BV is far lower than is reported otherwise out in the community. So for your vaginitis patients, your patients with vaginal symptoms, Evvy can really help you dive into the root cause of that, really help you to fully understand what's going on. Second, we work a lot with fertility patients. So there's a really robust basis of literature showing us that the vaginal microbiome influences outcomes like the ability to conceive, idiopathic infertility, IVF success, recurrent implantation failure, and even miscarriage and preterm birth. And so we have a lot of patients who had started to come to us of their own accord. They'd read this literature and they wanted to understand what their vaginal microbiome was showing them about their fertility. And so Evvy now offers fertility insights as part of the standard results experience. So if somebody indicates that they're trying to conceive or interested in conceiving in the future, then we will show them some of these key markers that the published literature has shown us to expect to be correlated with fertility outcomes. So the first is Shannon diversity and diversity within the microbiome. So the higher the diversity we see, the more that's linked to infertility and miscarriage and that sort of thing. Typically, of course, we would think of diversity, generally speaking, as being a good thing, but in the vaginal microbiome, it's actually not. You want low diversity. You want to primarily have lactobacillus species in your vagina, and say like the more BV microbes you have in your vaginal ecosystem, the higher that diversity is going to be. So we interpret Shannon diversity for folks as part of those insights. We also tell people how much protective bacteria they have because higher lactobacillus is associated with better fertility outcomes. And then we also go through a number of microbes that are known to be disruptive to fertility. So that's Gardnerella, Prevotella, Synethia, Fanny Hessia. And certain relative abundances, so meaning certain amounts of those microbes present in the vaginal ecosystem, has been linked to these poor fertility outcomes like idiopathic infertility and IVF failure. And so we identify those markers for those folks. And if patients are actively trying to conceive or trying to conceive within the next 6 months, in a shared decision-making model, we do sometimes offer antibiotics to those patients if they meet those fertility markers of concern. And we realize they're still just developing data on that. But the treatments, say, for BV microbes are low cost and low risk. And because we do vaginal antibiotic treatment, they are non-invasive and don't impact the microbiome in the gut and other factors, for example. So because we're engaging in this comprehensive approach to fertility, there's a number of patients who can benefit from Evvy testing. I would say if you're seeing a patient in your office pre-conception and they're the type of patient that wants to optimize everything ahead of time, I think doing an Evvy test at that stage makes a lot of sense for that patient. I know that I would want to do it for myself if I was in that position. Even if I didn't think I was going to have trouble conceiving, I'd want to optimize my vaginal microbiome, if only from like a potential miscarriage perspective. So that's a great patient to suggest Evvy testing to. The next is the patient who's maybe struggling to conceive. So perhaps if they're under the age of 35, they've been trying for more than 12 months, and they're starting to engage in a fertility workup. I think then looking at the vaginal microbiome to make sure that's not a contributory factor is super important. And then finally, for those patients who are already engaging in expensive fertility interventions, so let's say they are undergoing an embryo transfer, especially if they have only a small number of embryos, you really, really want to optimize those embryos' chances. And so making sure that the vaginal microbiome is primed for that, I think, is really important. So fertility is a huge category of patients that we work with. The next I would say is menopause. So, I mean, I know like in my own practice, I used to see so many patients who were menopausal who had vaginal symptoms. And sometimes you could prescribe vaginal estrogen and they would get better right away and you wouldn't have another problem again. But we know that lower levels of estrogen correspond with higher levels of abnormal bacteria in the vagina and an increased chance of having vaginitis. And so I think for those patients, particularly the ones that have shown themselves to be harder to treat, like, why not make sure that there's not a vaginal microbiome component to their vaginal symptoms? You know, when somebody comes in complaining of pain with sex or vaginal dryness or burning, it can be really hard to say, like, what is due to low estrogen purely and what maybe also has a microbial cause. Now, when we see those patients tested, sometimes they're diagnosed with frank vaginitis, and in other cases, they just have like a suboptimal vaginal microbiome. And overall, moving that toward a more protective state along with vaginal estrogen treatment can really help those patients. So I hope this summary has been helpful.